Good day, I am Nurse Bea and today I will be performing general survey. In performing general survey, we have 8 categories. So let's start first with demographic data. Good morning, ma'am. I have some few questions for you. May I know if you're comfortable with Tagalog or English?
Any language is okay, ma'am.
May I know your name, ma'am?
I'm Ariana Mago, ma'am.
May I know how old are you?
I'm 21 years old, ma'am.
How about your marital status?
Single.
Your occupation?
I'm student po.
And how about your address?
I'm from Angeles City, Pampanga.
Now we assess the chief complaint. When assessing for chief complaint, we want to use the patient's exact words. Ma'am, may I know what your concern is?
Headache po.
What makes it better or worse?
During I rest, it makes better.
Okay. May I know how did it begin or when did it begin?
I think last 2 days ago.
Well, how bad it is? How much does it bother you? Is it mild, moderate, or severe?
I think mild.
So from a scale of 1 to 10, with 10 being the highest, can you rate your pain?
I think 4.
Is the pain localized or radiating?
Localized, ma'am.
Is it steady or does it come and go during the time?
I think it come and go.
Okay. What makes the pain worse?
It makes worse when I sit or stand, ma'am.
Do you have known childhood illnesses?
None, ma'am.
Were you hospitalized before?
No, ma'am.
Okay. May I know if you're taking medications right now?
No, ma'am.
Does anyone in your family have heart disease, high blood pressure, or stroke?
No, ma'am.
Okay. Is anyone in your family sick right now?
No, ma'am.
May I know your educational level?
I'm currently a college student, ma'am.
Okay. Do you live with your family right now?
Yes, ma'am.
Okay. Okay. Do you smoke?
No, ma'am.
Do you take alcohol?
No, ma'am.
Do you have known allergies?
None, ma'am.
We want to also observe the patient's activity or exercise. So we want to observe and grade first the ambulating of our patient. So for our patient, the patient is independent. For hygiene, the patient's skin, hair, and nails is clean, thus it is considered independent. For dressing or grooming, the patient is appropriately dressed for the weather, thus independent. For feeding, the patient is not using any feeding devices, thus independent. For toileting, the patient is not using any assistive devices for elimination, thus independent. For physical appearance, we want to observe while interviewing the patient. So we want to check on the patient's level of consciousness while we are interviewing the patient. We want to check the skin, the facial features, and for signs of distress. We want to also assess the patient's body structure. So we want to check the stature, nutritional status, symmetry, posture, positioning of our patient. We want to also check the patient's height and weight and check on the patient's BMI for nutritional status. For mobility, we can assess that by assessing the patient's gait, range of motion, or involuntary movement. We can do that by asking our patient to walk or sit. For behavior, we want to assess for facial expression if it is normal, depressed, anxious. We want to also check the mood and affect, the speech of our patient, the way he or she dresses, and personal hygiene.